now I would like to give the floor to Eduarda, please, who is an associate professor of the Institute of Geography and Spatial Planning of University of Lisbon, and now currently she is the vice president of the institute, and anyway she is an URBACT ad hoc expert as well. Thank you.
Hello, good morning. It's a pleasure to be here. I hope you heard me. The sound is okay? It's okay? I hope so. So it's nice to be here. It's a very nice opportunity, not only to discuss the topic, but also to promote interchange about practices that will be very important in the next, I hope in the next years, but especially in the next months with the new context we have. When I was invited, they asked me to make more an overview. This means that I'm not going deep in the topics, but I will try to put some synthesis, and then I try to cross this with the planning, urban planning, that is also one of my subjects of work. So, it's okay? Do we see?
Yes.
Yes, okay, thank you. So I organized my presentation in 5 parts. Naturally, one is an introduction. It's a kind of an introduction to the concept. But then I try to separate it, what is in the literature and in the evidence about the relation between, of course, between green spaces and physical and mental health. But the third, fourth, and 5 parts, it's an essay to discuss this, the relation with planning, or the impact in the planning system. So I start by the topic in general that in fact, when we speak about urban green spaces, there are different definitions. I suppose that will be important in the project. That will be one question that will be fundamental in the concept that we discuss, what kind of green spaces you consider and the topic, because this is not innocent, because depending on the nature of the green spaces we define it for our territory, we have different answers and different target groups, and that means that we are going to have different impacts, because it's not the same to have a park or to have a children playing area, or to have something a private green area, and the time of use and the target groups are quite different, and naturally the impacts and organization in the city are different. So this is one example of classification. They are in the academics, different way to classify it. Some are more linked to urbanism, green urbanism perspective, some others are more linked to health cities perspective, some other are more linked to an environmental, general environment perspective. In any case, when you look at the work or the report about urban green spaces of the Wolf Organization 2017, in the right part of this PowerPoint, this slide, we have the typology. They consider it as green spaces, and they represent different levels of intervention. This is very important because, for example, when we look to picture 1, we look at that, it's a vegetation barriers along streets, but it's not the same thing when we look to number 7, recreational and urban gardening, the level of investment, the way we can implement this in the city, and for one question is very important, the available space we have, public available space we have to transform in our cities are quite different when we look at that picture 1, picture 4, picture 5, or the other ones. So this typology is something that we must thinking, because it's a possible one, but it's something we must think in the way we look at it, the implementation of, or to put new green spaces and to the results we want to obtain. So looking at impacts of urban spaces on health and well-being, something very general, because it's very huge to do it in 5 minutes this time. But again, the causal model that inspires some people looking at the system of implementation of green spaces in a local or regional scale is there very well organized in the point of view what we want. We have something, types of green spaces, then we look at for impacts, direct impacts. From the second level, the green is more this one, oops, sorry. This second level here and here are the indirect impacts we are going to have in this case in health. This means that we have direct results and we can measure these direct results, for example, by indicators. And then we should think, depending on the areas you are planning these green spaces, which kind of indicators we are going to have or we want to have, depending if it is a planning for the future, you want to have when you want to measure these consequences in health and in well-being, health status and well-being, a more general one. This aggregation in physical, mental, social well-being, and health inequity is the way World Organization of Health see the impact of the green spaces in the topic of health as a result of a second level of impact, not the direct one, but a second level of one. So let's think about 2 or 3 things that this last level here. Improve functioning of the immune system, physical condition, improve physical condition. This is the more common, the physical condition, the more common studies we see, and is completely proven. Of course, physical activity improves fitness, reduce obesity, it's good to cardiovascular, but something, for example, related with the topic of children, with the target group of children, we know also that green spaces, since the beginning, have specific allergens and bacteria, and that helps to the children to get more immunization for the future. So there are some aspects that we feel we understand directly because we have been discussing it in the last 10, 20 years, but there are other ones that are new and we could reinforce it, and they are also important to physical condition. Mental health benefits. During COVID, we have talked about this a lot. There are 2 perspectives, and I know the next speakers will develop this part also. We have the question of stress reduction, and in theory we have natural areas, we have activity, physical activity related, and we have a positive effect for this. But is this in general? Now you can discuss this as it's near our neighborhood, or when we put this in activities like the hospitals, or when we link this to our work areas. In the areas we work for the lunchtime, we must, for example, start to think in some examples, like for example, in the center of Paris, we have a big factory that was reconverted. Now they have gardening, they have green areas, and they have offices. So in the lunchtime, we can go down and we can gardening a little bit. It's an example to the stress reduction. And the other aspect, the other view, it's that these green spaces help in the point of view of focus or attention, restoration. And this helps also, not only at home, not only with some specific activities or enterprises, but also in the labor or in the labor context. The third aspect, more in general, it's improve social capital, social relations. They are different things, but we are not discuss this. And also social cohesion. And that improves also the sense of community. Of course, this is real difficult to measure, but when we look to this picture of the gardening, we see 3 groups of age, So we see environmental protection, we see physical activity, so we see social context, okay? We see valorization of the territory, and also some understanding and some focus on trust of the community. So there are many indirect impacts that you can take from an initiative like this. We have voluntary people that could help in interchange. So there are many opportunities to plan for the planning when we think in this kind of objective of improved social capital or social cohesion in the community. But some authors list some adverse association with green spaces, allergic disease, rate of infections. Some talk about security because some of these green spaces are related with toxic codependency, place of crime. So an image, also a bad image of a bad frequency in some hours of the day is the potential of crime. Also, there is an important aspect that green areas or the areas of the city that have more green areas or green equipments are also more valuable areas. So we can discuss that this could or not improve inequity or segregation in the city, and something that I don't support, but there are some authors, they talk about risk of skin cancer, but there are some authors that point. So the third part, now let's discuss a little bit about the factors that could influence the level of impact. And this is the normal chain of potential impacts. Green spaces, more physical outdoors, practice, less pollution, less noise, more social contacts, the general one list. And then we think that have more physical and mental health, and that goes to lead us to more well-being. And this is the chain of potential. But we see what we should have, but we should have distinct approach. And why? Why? Because it's not the same to make intervention in a neighbor scale or in the center city or in the general area of the city or in the, if you think in a regional, a suburban cycle or peri-urban area, that are quite different. So it's not a direct chain of impacts. We should think about the context. The scale and the geographical location are quite important to decide which kind of green spaces and to understand which kind of impacts we are going to have. The second aspect, it's the population, the target groups we have in specific territories. A municipality in global has some characteristics, but internal municipality or the region or inter-region, we have different characteristics. And there are behaviors different by age, by gender, by disabilities, by instruction, by socioeconomic conditions, and of course that have different impacts in health. Women tend to practice less activity. They have less time, so they have practice less activity. So the impacts in health are different from the guys or for the young people or for the others that could practice. So that leads us to look at the territory and look at that green spaces and link it with impact in health in social environmental favorable areas like this one, or in vulnerable areas like this down we have in the figure. The third element is we cannot forget the green spaces, quality of life, also depending what is more and more important in society, it's the time we have, the time free, the time of work and the time of non-working time. And that is terrible for some of families, especially families that increase in size with children under 18 years old, they are not self-sufficient. So the time, the free time they have to practice or to have to use the green spaces are organized in a different way from the people that are more young and they have more free time, or the old that are also, they have more free time and they have different ways, times hours to go to these green spaces. So maybe for the dense areas, in very high density areas with middle active people, we should think in green spaces that could be the effects of green spaces that we plan that could be not, I'm not defending passive people, but we should think that environment in general, green environment in general, could help people that don't have so much time to practice activity, okay? Because activity could be practiced in good to health inside doors, okay? So it's a different thing. So it's very important when we look at the characteristics of the territory, and if you look at the suburban area with high density, the questions that are to these people, it's available time to use the neighborhood, to fill the neighborhood. There's some evidence. This is a Turkish city. This part shows us that under less green spaces, less very proximity, they use more. So this is an example. Another example, I use it is for a periphery of Lisbon. We made a questionnaire and we understood that near again neighborhood proximity improves the use of green spaces, the use of outdoor activities and practice, but there are many things that we must relate it. And one of the terrible conclusions, it was that people that have less time use the car to go to green spaces once a week. This is a contradiction. What we want, of course, they use in the weekend because the time they go to more far, but in fact is a contradiction what we want and the importance of green spaces for the diary life, for the general activity. A fast look of these maps is quite interesting because these maps not only show an opposition between north and south of the world, and you feel that in the south it's not only the question of availability of green spaces, but it's the question of security, okay? If you go to green spaces outside in some countries, on some areas like in Mexico and Brazil, you have fear. So the question of security, insurance is very relevant. But in the north, you see on June, in European context, it was less important than now in August. People get out. It's the summer, it's holiday time, it's free time, and people was more outside. So that is very important to know because we need as a planners to understand which kind of families and people in time we have to integrate some of the orientations to improve the impact of the orientation. So to get more impact, we have to put green spaces close to people, naturally. Availability, accessibility, visibility are aspects very important to this. We have to adapt to this to diverse demands. We have to improve the comfort because it's very important. If you have old people, you need to have support for go to WCs and this kind of safety use and this kind of aspects. And of course, one thing that is very important, it's the maintenance needs of these green urban spaces. And that is very relevant for municipal level because this is related with costs, okay? People, employment, and costs with the maintenance. The other aspect is important to get more impact. It's you want to know exactly what you want to attend. So the one target group is young people. We look at our characteristics of the territory and then we look at it. Maybe school environment, we can link it with young people. Public parks with organized sport activities, and then we can combine things of social, of course, and sport. Gardening integrated with voluntary activities, and then we get the same impact. More physical and more mental, more well-being, and we have, okay, another we must try to have other kind of collective impacts. And then we look at it, the expression maybe improve in some more vulnerable areas. If we occupy young people with some interesting activities, we have this example in some municipalities of the metropolitan area of Lisbon. We improve school results, we improve social integration. Okay, this is social, but that helps also to the mental and to the physical and well-being system. So, oops, sorry. 6, it's the question integrate green spaces in an intersectorial policy and in the framework of sustainability. So Health City looks perfect to this system, to what we want in this linkage between green spaces and health, but a perspective of green urbanism or eco-city doesn't leave the health outside the strategy. Maybe the 4th main focus will be more green, and the complementary focus will be health. If you look at the Health City principles, the focus is more social and the complementary is green. So it's the way we integrate it, but very important, depending if you use the English system, sustainable community, or intelligent city, or wish-friendly city, or green, the support, the frameworks, the idea, the principles, we must integrate it. And it's very important to consider that different levels of organization and different entities are linked in this process. So let's think about what is sustainable mobility. Sustainable mobility in this moment is like in City Lisbon, that is a green city, is very, very interconnected with green spaces, okay, walking areas, bike areas, and that have impact in health also. Not only impacts in the environment, but also impact in health and more well-being. So it's the way you want, what we want to attend, and that help us to redefine what we consider the main causal, the main chain of impacts we want to obtain, and what is important to invest to get some of the impacts. Another example, almost finishing, 3 municipalities of the suburban area of Lisbon have integrated themselves, and they have put it the green is blue because there is a river, also, but it was a green corridor. And it combines the mobility. You can go by bike, or to the next train stations, or it combines also with proximity parks. This is a more distant area, but if you look at, you have some village, small village near here that are linked and then could link to this green space. So it's an integrated strategy that is intermunicipal, and that helps also in a collective way to help the more intermobility between these 3 municipalities with impact for the 3 in health of the challenge for the final. So clear in the objectives of green space planning, make use of what we have about what is the best topic about causal impacts, and have a long-term vision for the city. That is very important. And consider that green space are projects not only for environment, but for health and social investment. And that helps us to justify the efficiency of the project and the discussion of the relevance of the project in the city. Finally, now we have this challenge about Sustainable Development Goals. 11 is directed, but there are others like reduce inequalities, or the questions linked to environment, or even gender equality, because something related with practical activities is not gender equal. And that global vision must be integrated with local action, multi-sector, but that depends. and that is very important to know, of local administrative competences and the kind of planning and financial resources we have. To finish, all the organizations have made an interesting roadmap that links all the sustainable development goals to the goal of health. And we must do this work for our system. So link, if you want to have good health, how green spaces could be integrated in the policy of this, and how the other sectors could contribute to this. Not only for thinking in the investment, but also to think in the impact system of indicators we are going to have. And thank you very much. I don't know what will be the next future. I hope it is in the right and not in the left, or closer than get it at home. Thank you very much.